When you go to the beach, do you find yourself hiding your feet in the sand, or do you simply wear your shoes on the beach? Take care of those ugly, embarrassing fungal toenails. Come in today for a consultation.
I'm Dr. Fred Kussel. I'm here to talk to you today about the CT3 laser from Kussel for treatment of onychomycosis. This laser is a state-of-the-art laser. It's unique in the fact that it's thermally controlled and has a cryogen spray to regulate the temperature of the nail plate for greater patient comfort and to reduce the risk of tissue destruction. This laser has not met FDA approval. It's pending clinical investigation. So at this point, this is considered a cosmetic treatment. Just like Botox took almost 10 years prior to getting its FDA approval, the laser is a light source which generates heat in the nail plate to destroy fungal elements and pathogens which cause onychomycosis. It destroys the fungus in the nail plate, under the nail plate, and in the tissue surrounding the nail plate. Basically, there's 4 types of pathogens that cause onychomycosis. Number 1 is superficial white onychomycosis, which is a white layer of film that develops on top of the nail plate. There's a distal subungual onychomycosis, which ends at the free edge of the nail plate. Also, there's a proximal subungual onychomycosis, which starts at the cells where the nail grows from. The last final pathogen which causes nail fungus or thick dystrophic nails are yeasts called Candida albicans. All 4 of these pathogens are destroyed by the laser. The lasers have been in use for approximately 2.5 years now for research and development to treat onychomycosis. The initial laser that came out was a pinpoint laser, which in fact the beam that was emitted from the laser was a pinpoint, hence the name, where the laser was used and it had to be done in a cross-hatch pattern across the nail plate from side to side, from front to back, and then on a diagonal. The nice thing about the Kussel laser is that it has a laser beam that you can dial from 3.5 millimeters to 10 millimeters, so there's greater overlap and less chance for operator error, missing potential fungal areas. Up to this point, the treatment of onychomycosis has been limited to oral medication, which was both expensive and requiring blood work, as well as the topical medication, which required daily application and patient compliance. The lasers that we have today are between 80 and 90% effective in the treatment of onychomycosis. They are the highest rate of success of any product out there to date. This treatment, however, is more effective than the oral antifungals, which proved to be about 56% effective, with a 20% recurrence. The topical FDA-approved medications, such as Penlac, which are 36% effective, with a 20.5% recurrence rate. This medication needs to be applied daily, removed weekly with nail polish remover, or better yet, acetone. Some excoriations need to be placed into the nail plate, and then this process needs to be repeated daily for a total of 18 months. Home remedies at home that patients use to treat onychomycosis, which are virtually useless. So to date, the laser has no side effects. There's no medication involved. There's no preoperative or pre-treatment blood work that's involved, intra-treatment blood work that's involved, or post-treatment blood work that's involved. No needle sticks, no anesthesia, and no pain. Whether you have 1 toenail involved or 5 toenails involved, all the toenails of the infected foot have to be treated. This helps reduce the possibility of cross-contamination from one toenail to the next. Just like that foot sleeps in the same shoe and the same sock on that side, we have to make sure that we rid any pathogens that could possibly reinfect the toe that we've treated. There's a free 10-minute consultation that we offer to every patient. It is strongly recommended at that appointment, if you don't have or haven't had a previous biopsy of your nail plate, that in order to practice good medicine, it is recommended that we take some clippings of the nail and submit them to a laboratory where the patient can have these nails evaluated under microscopic evaluation with potassium hydroxide and check for any dermatophytes. If the culture comes back positive, then we know that the patient indeed is a candidate for laser treatment. Unfortunately, there's a high rate of negative cultures, and sometimes we are not able to isolate the pathogen from the nail plate, from the clippings we take. Generally, these are in the patients that have trimmed their nails down so much that we're not able to ascertain a good clinical specimen for submission. The way the laser works is on the day of the first treatment, we use the laser, which again sends a light and a heat source to heat up the nail plate. Our laser is controlled thermally with an infrared temperature sensor, and the laser emits a cryogen spray at the point when the nail plate reaches 40 degrees Celsius. The same procedure is performed all the way across the board on all 5 digits. Then we go back and repeat, nails 1 through 5 again on that same foot, and then a third time on that same foot. Your nails grow approximately 1/10 of a millimeter a day, which in 10 days that's 1 millimeter. In 1 month that's 3 millimeters. A normal individual should grow out a healthy nail within about 8 to 9 months. However, you throw in the factors of age, chronic health conditions, smoking, and diabetes. These can retard the growth of the nail plate and can cause an individual to take up to 1.5 years for a new healthy nail to grow out. The initial follow-up after the laser treatment is at 4 weeks. At this point, we will look to see for a zone of nail clearance at the skin fold where the nail grows from. If we do not see any clearance at this point, we'll go ahead and administer a second treatment. We'll bring the patient back 8 weeks later, so it's at the 12-week visit, and we'll reevaluate at 12 weeks. If we still don't see clearance at that point, we'll administer a third treatment. We want to make sure that if it's potentially possible to cure the patient of onychomycosis, we're going to do everything we can to get rid of the fungus, and that's why we're offering 3 treatments per patient for the initial visit charge. Unfortunately, due to the fact that it's only 80 to 90% effective, there are 12 to 20% of the individuals who have laser treatment will fall outside of the clinical treatment parameters, and they will not have a successful outcome. Therefore, there's no guarantee when it comes to laser treatment because you could be one of those 12 to 20%. After your laser treatment, we will send you home with an informational packet that contains the necessary guidelines for you to maintain healthy feet and to prevent a reinfection of this onychomycosis. Laser treatment is beneficial in the fact that patients can leave right after the procedure is performed. There's no need for sedation to wear off, and there's no pain involved, restoring them to their normal activities immediately.